typical patient that would come and see me is a patient who has been chronically ill for some time now. They have probably seen upwards to 10, 15, sometimes even more specialists and doctors just to try to figure out what's going on with them. They will have then either heard of someone who was dealing with chronic illness or read a paper somewhere or came across a show. So then they did some investigating themselves and they become their own advocate to really find who the right practitioner is for them. So a lot of our patients come to us after having seen a lot of these doctors that just didn't have answers for them or get told that that there's nothing wrong with them, or it's just depression, or they're just getting old. So that's kind of the typical patients that we see. And once they come to us, then we do a full workup, try to see what has been done, what hasn't been looked at, to see if we can help them. Most of the patients that come to us typically come to us first because of tick-borne infections. Not everyone that comes has them, but that's how they first hear of us. And not only do they then have tick-borne infections, but we start to uncover other things. For example, they might have mycotoxins or mold exposure, or they might have heavy metals. They might have food sensitivities, leaky gut. We do see the pandas population, the autistic spectrum population. So they initially come to us for tick-borne infections, but really it usually is not just those infections that we're dealing with. The pediatric population can get pretty tricky just to see what they're dealing with, how many issues that they have health-wise. But the patients that I see that come in for the pediatrics, some of them are complaining about joint pain, fatigue. They're just not as active as their peers. So the parents have taken to the pediatrician, done a workup, and just still can't figure out what's going on. There's that group of the peds, but there's also another group where these patients, they are on the autism spectrum. Many of them have been worked up by other doctors and have had heavy metal issues, food sensitivities, but then get referred to me to look at the tick-borne infections. Now, not everyone on the spectrum has these tick-borne infections, but we have found a significant amount of patients do. And so when they come to me, I work up the infection portion of their whole health profile. I also see the pandas population. Same thing, there's usually quite a few things going on with these patients. So we try to work them up, work on inflammation, work on infection. So I do see the PANS population, the autistic spectrum population, but then also other pediatric patients that just aren't as healthy as their peers.